Mbale Express TV nga twakutegeezaako nti Ebola yasobola okuba nga atayingira mu kibuga eky'Embale. Olunaku olwaleero Minisita atwala ebyobulamu mu ggwanga erya Uganda Dr. Ruth Aceng asobodde okuba nga atuuka mu kibuga eky'Embale era ng'ayogeddeko ne bannamawulire ku mbeera ekirwadde ky'Ebola gye kiyimiriddemu mu ggwanga erya Uganda ssaako ne mu region eya Bugisu n'Embale nga City. Katukutwale direct mu press conference olabe ebibaddeyo. World Health Organization eyogedde ku sanctions za Trump zeyataddewo naddala ku buyambi obujja mu Africa. Dr. Ruth Aceng n'ensonga zayogeddeko Ebola wabyabufuzi ali political oba kirwadde kya ddala. Ne Dr. Atwine PS wa ministry ey'ebyobulamu naye asobodde okuba nga ate abaako ne byayogera. Byonna ku Mbale Express TV katukutwale direct mu press conference.
And the district task force on Ebola. And the persons you see here, I will quickly introduce them. I think I know all of them. I will start with the right, my right-hand side. The one nearest to you is called Aceng Kajirita, who is the incident commander here in Mbale. Next to Aceng is the Permanent Secretary, Ministry of Health, Dr. Diana Twine. Next to Dr. Diana is the RDC of Mbale District. All of you know him. You can even tell me his name. You can give it to. Next to him is the RCC of Mbale City. You also know her. You can give her. You can tell me her name. Jane Ruth Aceng is my name, the Minister for Health. On my left, we have Dr. Grace Kasonde Mwiga, the WHO country representative in Uganda. Next to her, the gentleman, is Dr. Mike Ryan, the Deputy Director General WHO headquarters from Geneva, but also in charge of epidemics globally. Next to him is Moses or Patrick Aboka, who is the incident commander of on the side of WHO. Then we have the Director General Health Services, Ministry of Health, Dr. Charles Solaro. And next to Charles is Dr. Colonel Dr. Henry Chove, who is the incident commander for the nation. Thank you very much for the questions. Let me begin with how is government prepared? That is a very important question. The good news is that we are all government, isn't it? Including yourself. So I could actually turn the question back to you and ask you, how are you prepared? Because your preparation is extremely important. Not only what you're calling government, which is the system. Government is all of us, and all of us must be prepared to bring this outbreak under control. But to put it in the context that you want, the government of Uganda since the year 2000, when we had our first Ebola outbreak, has been building capacity to control outbreaks in this country. So we are able to detect on time, and we are able to respond on time. And many of you are aware that we have had several outbreaks. If I talk only about Ebola, this is our 8th Ebola outbreak. But we have had other outbreaks as well. And you have been moving with us along as we control these outbreaks. So government has a number of systems in place. And when we talk about detection, there is prevent, control, and detect. If we talk about detection, we've built capacity with laboratories. Here in Mbale, you even have a mobile laboratory within the hospital. That is being prepared so that the samples are delivered there and you receive your results in real time. And for Ebola specimens, real time is 4 hours. We don't have to take the samples to Kampala. We don't have to take the samples to Entebbe. Anywhere in Uganda where an outbreak happens, we can position laboratories. We have field epidemiologists, adequate numbers to handle. We also have a system for us to communicate information in real time through our emergency operation centers, which are in all the regions of the country. And these emergency operation centers are all linked to a central emergency operation center that is at the Ministry of Health headquarters. We have vehicles in place. You remember the COVID vehicles? Everywhere for surveillance. We have emergency medical services, that is the ambulance system that is interconnected the entire country. But most important, we have you, the media and the communities, who are the most important in this outbreak. So our being here in Mbale is not about the government system of preparedness, because the government system exists. And I have not highlighted all, I've only picked a few. Our being here is to empower you people with information, is to tell you that you need to engage more with the communities, is to keep you vigilant and alert, is to emphasize the fact that we must work in solidarity to bring this outbreak under control. And that is why we came in solidarity. We need everybody to participate. So the answer to your question is that yes, we are prepared. The update is that we have Ebola cases in the country, and they are receiving treatment and they are improving. The update is that we are still carrying out intensive surveillance to pick any case, if any exists within the communities, and we need you to report any suspected case on time to us. We have already set up isolation facilities for purposes of treatment. In that isolation facility, we have 3 separations. We have for suspected cases, we have probable cases, and we have the confirmed cases. And if they are confirmed cases, they will go there after laboratory confirmation. What I want you, the press, to know is that we shall be giving you updates every 2 weeks, not every day. So don't ask us cases, whatever. That is not important. What is important is that you get to the communities and tell them they need to protect themselves and they need to pass on information. What is Ebola? A viral infection that presents with a fever, joint pains, general malaise, bleeding from the body openings, the mouth, the nose, the gums, you name it, the anus, any body opening. And when you see such a presentation, please report to the nearest health facility. What is important is for them to know that our index case of Ebola passed through Mbale Hospital and also interacted with a few people in the communities. That is why we need the community to be vigilant so that we can pick out the cases from the communities. What is important for you to pass on is that the outbreak will be stopped by the communities. They are the only ones who can control. It is not that government system that you're asking about. Outbreaks start in the communities and end in the communities. And so we need the communities to rise up and, be vigilant and say we don't want Ebola in our community, so we are going to educate one another and we are going to weed out all suspicious cases to the facilities. And Ebola will end, just like it ended in Kasanda and Mbale. Should the community be alarmed? No. And I love the Uganda communities. They are never alarmed. They are our best asset ever. And that information, please take it from me to the communities. We appreciate them. They have been our most valuable asset. The fact that Uganda is known for controlling outbreaks on time is because of the Ugandan community. Because they listen and they respond. So they shouldn't be alarmed. We just want them to respond in the right way. Educate one another, report any suspicious case, do not be alarmed. Everything will go well and we shall end this outbreak on time. I thank you.
Since you declared about this,
The question is a very important one. Tourism. Is it safe for our tourists to come in? Yes. Extremely safe for our tourists to come in. Not only tourists, even those who want to travel, even those who want to trade. You're not very far from the border with Busia and Malaba. Please go ahead and trade. Even when we have an outbreak, we don't restrict tourism, trade, and travel. In any case, the outbreak is in well-defined areas. It is not widespread all over the country. Uganda is very safe. And I repeat again, Uganda is very safe. And we encourage all tourists to come to Uganda. We encourage trade, we encourage travel. And we are here, we have traveled from Kampala, we are here. And we have found the people of Mbale very alive and well. All of you look good, okay? So, when you are passing on information, please let the tourists know that our hotel facilities are available. The tourism sites are very safe. They are free to move. The transport systems that they travel in are very safe. They are free to move. Every other thing in the affected districts is under control. And it will not affect them. Unless the tourists want to get monkeypox and they visit the commercial sex workers. But there is no threat of Ebola anywhere where the tourists will go. You asked about where the outbreak is. All of you are very much aware that the index case visited Mbale, visited the regional hospital, and visited a traditional healer here in Mbale. I don't know where. You are the people who know. But you're also aware that the index case died in Mulago. You're also aware that the children visited Jinja and some of the other clinics that he visited. So those are the areas that we are following up. Only those areas are areas of concern. However, we encourage the rest of the country to remain on alert and remain vigilant because Uganda is prone to epidemics and anything can happen anywhere. So remain on alert, remain vigilant, report any suspected cases. What method are we going to use to calm down the population? Please be calm. Uganda has always controlled any epidemic. This is the 8th Ebola epidemic, and you are still alive. The very person who asked the question. Have you ever got Ebola? Because wherever you go, you see our people in action. But like I said before, the most important people are the population. So they don't need to be alarmed. They just need to be calm. All we need to do is to get out those with suspicious signs and protect ourselves. How do you protect yourself? Number one, please avoid contact with any person with suspicious symptoms and signs. Fever, high-grade fever, vomiting, diarrhea, bleeding from the mouth, the gums, all the body openings, report those cases. If you have somebody who is sick at home and you're not very sure, please use protective gear. At your home, I mean. Use a glove, but quickly inform the medical personnel to come and see the patient. They will come. There are ambulances that are set ready for that. Do not share clothing with the sick people. Don't share beddings with the sick people. Wash your hands with soap and water at all times. That was not only for COVID. That is one of the things that the population of Uganda forgot. When COVID, when the number of cases went down and it became no longer a public health disease of concern, everybody stopped washing hands. But washing hands with soap and water must never stop. It is a standard procedure for always, not only in the face of outbreaks, for always. It is a standard procedure. Or use hand sanitizers. And that is also for you, the press, because the whole day you're moving around with your cameras looking for information. You even forget to wash your hands. Please wash your hands and avoid contact. Now, the issue of a political thing, I'll talk about it after the safe burials. We are concerned about people who pass on in the communities. And sometimes it is not reported. Sometimes the communities don't even care about the signs and symptoms. They just proceed to bury. But I will also combine with what we are doing, should any case die of Ebola. We have only had one case, the index case, who has died. But should any case die of Ebola, we carry out what we call safe burials, safe, dignified burials. What do we do? The relatives are informed. We accept 1 or 2 or 3 members of the family to identify their loved one from a distance. You can see from a distance, you can see that that is Okelo or Dongo or whoever. That is our person. And then we put you in our body bag and zip. And our people will ensure that a grave is dug and you are buried safely. We allow a few members of the family to attend the burial. We don't want more than 10 or 15 members. I don't remember the maximum number we allow for the burial. 15 only, and you stand at a distance. We allow a religious leader to be present to say prayers, and then we bury. And when I'm saying we, I mean the safe burial teams. They will be there well dressed in their gear, because when we are burying a case of Ebola, we want to avoid spreading infection. And we humbly appeal to the religious and cultural leaders, do not perform rituals on the bodies, because we know that our brothers from the Muslim religion clean the body. We discourage that when a person has died of suspected Ebola or confirmed Ebola. Please do not perform rituals. That is why the safe burial teams take charge of the body and bury. That also goes for the cultural leaders and the Christians. Avoid any kind of ritual on bodies. Let the burial teams take control and bury the dead. Do not exhume bodies that have been buried. Do not exhume bodies for whatever purpose, because that body is highly infectious. And you will spread infection to the community when you make that mistake. So allow the burial teams to carry out the burial. And should the burial teams decide to to bury your relative, please do not resist. Do not refuse, do not resist, because they will be guided by the entire task force. Remember, he said there are deaths that occur in the communities, and unless samples are taken for confirmation, we don't know. But none has so far happened, we are not aware. Last, you asked the political thing. It doesn't choose a political party. I am sure that all of us here have our own parties. Ebola does not choose to only infect the movement or the NUP or the FDC or there are so many political parties I'm forgetting. UPC, Ebola doesn't choose. Ebola does not choose any religion. It does not choose any culture. But of course, if you have Ebola and you start performing the traditional circumcision, you are at a very high risk. Very high risk. Don't attempt, because you don't know who is infected. Ebola, I also heard from my friend Dr. Ryan here, does not look at your bank account to choose whether your bank account is loaded so that it comes to you, or your bank account is empty and it comes to you. Ebola affects anybody and anyone. And it can, any of us here is a candidate. So let us avoid politicizing Ebola. And I know why that question came. Because usually when the Ministry of Health declares an outbreak, like the PS declared the outbreak on our behalf, then people start saying the Ministry of Health is looking for money. They have run out of money, they are looking for money for themselves. We are health workers. Anybody that is part of a task force addressing health is a health worker. And when I say health worker, even the RCC here is a health worker. Even the RDC there is a health worker. Even you, the press, when you report on health, you become a health worker. But the professional health workers swear, and we swear to save lives first and do no harm to anybody. So there is no reason whatsoever why we should declare a false alarm when there is no outbreak. There is an outbreak. And the first question I asked the leaders here was whether they believe there is an outbreak here, and all of them said yes. So there is an outbreak. That is why it was declared. We don't declare outbreaks politically for any reason, no. If it was politically, then we would be declaring outbreaks every month. Why not? But why should we declare an outbreak in 2022, then in 2025? That is not political. There is a real outbreak. And we don't declare outbreaks because we are looking for money. But we need money to control outbreaks. You cannot control an outbreak without resources. You need resources to deploy people on the ground for commodities. You need resources for fuel, transport. You need resources to treat the sick. We need the resources. And that is why, one of the other reasons why we declare, because when we declare, then partners like WHO will come down in solidarity and support the response financially, but also with human resource and knowledge and wisdom. And then other partners will also mobilize resources from within their resources. You have seen several partners have been here. When they hear the declaration, that is like okukube nduru. They say, yes, there is a problem. Let us go and support. That is even done in our communities. When you have a problem, you make noise and people come to support. So we declare and they come in to support. We also declare outbreaks so that you people, the population, are aware that there is a challenge and you need to be very vigilant. It is an awareness creation. Because if we keep quiet and, say for example, the index case came here, we would never know. But now when we are tracing, you rise up and say, he went here, he passed here, so and so carried him. That helps us to pick out the contacts. So it is nice to declare an outbreak. But also, we are bound by the regulation, the International Health Regulation, which is a binding document for 194 countries in this world, and we signed as Uganda. So we declare, so that all the countries in the world are aware that we have a challenge. But we are not going to export that challenge to them. We are going to control it from within. And that is why me and you must work together. But it also helps them to prepare, especially those that border Uganda. They also get prepared. But allow me to reassure them that no case will leave Uganda to take infection out. We have never allowed that to happen. It will never happen. And want to reassure the international community that Uganda has the capacity to control this outbreak. And Uganda will control this outbreak. And we are not going to export any case anywhere. Uganda remains extremely safe. Please come and visit Uganda. Lastly is about the vaccines. I'll just talk a little bit about it. Yes, we have vaccines in the country. The vaccines we have are trial vaccines for Sudan Ebola. The Ebola variant we have is Ebola Sudan. They are trial vaccines because they are still under research and the World Health Organization is monitoring. So when we get opportunity like this, we use it. And we get the information that we need. We need to know how protective it is, how long the protection lasts. But what you people need to know is that for Ebola Zaire, we have a vaccine whose research was concluded, and WHO will talk about it. For Ebola Bundibujo, because we've had all these variants in this country, we don't yet have a vaccine, and we don't even have a trial vaccine. But for this one, we do have. And we have already started giving the people at risk. Those are the contacts. And we have given contacts here in Mbale, we have given contacts in Kampala as well. So over to you. I don't know who is going to talk. Either.
Vaccination, but I just would like to reinforce the words spoken by the Minister. Uganda is safe. Uganda is business and tourism should continue. The problem, there is a problem, the Minister has outlined it. The issue with life is not whether there's a problem. There are problems all the time. The question is, are you aware of the problem? Are you managing the problem? And will you end the problem? And I'm very convinced that Uganda is very aware of the problem. It has communicated openly with WHO and international partners. It is a plan to deal with the problem, plans that have been in place for many years. This is not the first time that Uganda has had to deal with a disease like this, and has successfully done it each and every time. And it's very, very important. The disease is in a very limited number of places, in a very specific chain of transmission, for which all of the contacts have been identified. And for the first time in Ebola Sudan, a vaccine has been deployed. With the vaccine is an RVSV vaccine. It's a vaccine that's based on the same technology that was used to develop the Ebola Zaire vaccine. In laboratory studies, it's proven highly effective at preventing infection. Human studies have shown it to be safe, but it is still under evaluation, and as such, it's under a Uganda, the government are not only and the research institutes are not only doing a service for the people of Uganda, they're carrying out a service for the people of the world. Just like the people in Guinea did with the Sasufi trial for the Ebola Zaire vaccine, and then subsequently in Congo, where both of those events proved the effectiveness of the vaccine, and it is now licensed and available for all countries. We would like to have a similar situation for the Ebola Sudan strain. I would personally like to thank the Minister, the Principal Secretary and the Government of Uganda for this international engagement of solidarity with us, the global community. And I'm here with Kasonde, with Patrick, with Andrew and everyone else at WHO. We are your servants, and we're here to serve Uganda and the best interests of the people. The vaccine has not been given to everyone. We have proven in other outbreaks, and the Minister mentioned this disease passes from person to person. It's not in mosquitoes, it's not in the drinking water, it's not going through the air. The vaccine, or the virus spreads through direct contact between individuals. And there's a chain of transmission. It's like a chain where the disease passes from you to another person, then from the other person to their family potentially, or somebody else, whoever you meet and touch when you're sick. So in that sense, what we try to do is identify everyone at risk and try to vaccinate them. What we hope is that the vaccine will reduce the chance that they will get sick, but even if they do get sick, what we've seen with the previous Ebola Zaire vaccine is that the disease may not be as severe in those who get vaccinated. Two benefits. So I would encourage anyone who is a contact and feels sick, come get diagnosed, because with vaccination, with access to therapy, and again, Uganda has achieved amazingly low mortality in previous outbreaks. Come to where the doctors and nurses are trained, the Ugandan emergency medical teams are, who are trained to give the highest possible care, to use therapeutics, to give vaccine to contacts as well before. We believe we can get the mortality associated with this virus down to very low levels. Uganda has already done that previously. With vaccine, with excellent intensive care, I think it could become even lower. So I think Uganda, on the one hand, it's a challenging time, but on the other hand, Uganda should be very proud to contain this virus and what it's doing to build global knowledge for the future. So my feelings today are those of gratitude, those of respect, and those of solidarity. I was saying to my colleagues, this day, 24 years ago, I was returning from having spent 7 months in Gulu in the first Ebola Sudan outbreak, way back. So Uganda is very close to my heart. I spent 7 months of my wife's first pregnancy here. And my daughter was born 4 days after I arrived back home. So my family and our families within WHO are closely linked. Patrick is one of you, and he's our incident manager. Sunday has just arrived as the new country representative here with huge experience. This represents the 3 levels of our organisation. We are based in country, always with the ministry and for the ministry. We are here before outbreaks, during outbreaks, and after outbreaks. We are here for health. We are here to protect health, promote health, and help the government to provide the best possible health care. Our regional office is here to react quickly to crises and be on the ground immediately, and at headquarters we're here to supplement and provide extra support. So today we sit in front of you as humble servants, the 3 levels of our organisation, because Uganda is a member state of our organisation. This is not charity, this is not us helping Uganda. Uganda is a massive contributor to global knowledge, a massive contributor to global health security, and when Uganda faces an issue like Ebola, we come because we work for you. You are our bosses. Uganda is a boss. We have 194 member states. They are the people who own our organisation. They are the shareholders. We are the servants. So we're here in solidarity to serve the people of Uganda and the government of Uganda. Thank you. The issue of the potential withdrawal of the United States from the World Health Organization, we're very saddened by that prospect. As I said, 24 years ago here in Uganda, we spent months in the field with Ugandan colleagues, with colleagues from CDC, with colleagues from the United States government. I have served for more than 30 years, side by side, in the same tents, sharing the same vehicles, sharing the same food with many colleagues. So I'm saddened and disappointed that that might happen. And we hope that that won't proceed. But let me reassure you, WHO's capabilities to support outbreak response remain undiminished and undiluted. Within hours of the Minister and the Permanent Secretary announcing the outbreak, we were sending large sums of money to support the response here, and we will continue to do whatever it takes to do that. So let me reassure you that that's a global matter, and it's a process that's happening. It will not affect our capacity to support the government of Uganda, but obviously we will have to look at the long-term consequences for WHO as we go through the process with the United States. But this may take a year or 2 years to complete. So sometimes in life you need to worry about the crisis you have. If your roof is burning, you're not worried about building a wall around your house, okay? You deal with the thing you're dealing with. Right now we're dealing with Ebola and supporting Uganda. We will deal with the other issue in due course.
I wanted to add on safe, dignified barriers. We have teams and we have individuals who put on like going to the moon, and these are our own. We need to be kind to them. I know in one place they were harassed and the population was very harsh towards them. Please, they're just doing their job, and they're doing a job to protect the population. Be kind to them, don't harass them, and actually appreciate that they are doing a very difficult job, which you needed to take them. Ebola. To some individuals, those we may draw some samples and test them to ensure that they have not died of Ebola. And this is what we call mortality surveillance. And the aim here is to make sure that we don't leave any stone unturned. And as the minister said earlier, that there are a combination of interventions. No single intervention is effective, but whatever small intervention there is very important for us, be it looking for individuals that have been exposed, be it at the facility when you are testing your temperature, or asking you questions. Sometimes it may be disturbing. Please understand, so that we are able to get samples quickly, test them. We are glad we have a lab which arrived just 2 days or 3 days after when the outbreak was detected. This capacity, I think not many countries do have it. And of course, when we isolate individuals, actually for the good of the population. And of course, our biggest tool, Honorable Minister and the colleagues in the press, is information, as Honorable Minister said, and listening to the guidance that we are giving. I think I will speak about the case that you have alluded to.
All these alerts, because they make our work easier and we respond quickly. So in specific to this alert, after it came in last night through the office of the LRCC to the command center. The command center was active. We responded and got the dead body and made it safer to stay where we were able to put it. Early in the morning, our teams, the SDB, Safe and Dignified Burial Team, the laboratory and the epidemiology team, they swung in action. They took samples and they are handling the body. So the body will be buried by our teams, and the results should be ready today, because by the time we started this meeting, the lab had already started the processing. So be rest assured that every process has been handled quite properly, and we're in charge. Thank you. Sorry.
I just want to add that we have a toll-free number.
Ebibuuzo byammwe ekisoose kibadde kibuuza nti twetegese tutya. Nga bwe mumanyi nga okwetegeka kuno kwatandika emyaka egisukka mu 2 egiyise okuva lwe twatandika okufuna obulwadde buno obwa Ebola. Mujjukira ababaddewo nti bwe twasooka okufuna Ebola, omusaayi twali tugutwala America nga tumala myezi kufuna results, nga tumala n'obudde buwanvu nnyo okumanya kika kya Ebola. Njagala kubategeeza nti obusobozi obwo tubulina kati. Kyovola nti n'omulwadde yafa kiro ne bamuggyako sample nga tebunnaba kukeera. Twamanya obulwadde obwali bumusse, ate ne tumanya n'ekika ekya virus. Ekyo kyali kitwala obudde buwanvu, naye kati tusobola okukimanyirawo. So obukugu obwo tubulina mu ggwanga ng'abakozi baffe, abasawo baffe, aba technical bamanyi ekyokukola buli lwe tuba tufunye obulwadde buno. Edda twali tetusobola kukola test wonna mu field. Mulaba nti kati wano mobile lab yaffe eri wano, era omulwadde bw'alwala bamuggyako omusaayi ne bamukebererawo ne tumanyirawo olunaku olwo, ate ne tukola ekitugwanidde. N'olwekyo obusobozi tubulina. We tutaali omulwadde ono bwe yagenda gye yagenda yonna, tulina obusobozi. Abakugu baffe bano abanoonyereza bagendera ddala mu byalo ne bakozesa obukugu bonna, be tuyita contact bonna babafuna bonna, era tubayina bonna. So n'olwekyo obukugu obwo tubulina. Omulwadde bw'alwala Ebola era tulina obukugu obusobola okumujjanjaba, ate abasinga nga bwe muwulidde aboogedde nti abalwadde baffe kati tutandise okulaba nti buli lwe tufuna Ebola balwadde batono abafa. Lwaki? Obukugu bweyongedde obujjanjaba, ate kati n'ekirungi tutwafuna n'eddagala lino lye tugezesa, ate tumanyi nti nalyo lijja kutuyamba okukendeeza abalwadde abafuna obulwadde obuye nnyo. Minisita ayogeddeko nti amaanyi gaffe gali mu community, mu bantu, era kyekituleese wano okunnyonnyola abantu omulimu gwe balina okutukolera, okutubuulira abalwadde abafudde mu community, contacts maybe betuyinza okuba nga tetumanyi. Community yetuyamba bulijjo okulwanyisa obulwadde buno. N'olwekyo era ne kati tugamba nti community era yejja okulwanyisa obulwadde buno, era yesobola okutuyamba ne tubuziyiza mangu ddala mu budde obutono ennyo. Ekirala kye tukoze, maybe minisita kyeyatayogeddeko, ekyokuteeka abantu ku booda nga bakebera abantu, ate ne ku airport, kubanga ekyo kituyamba okulaba nti tewali muntu yenna asobola okugenda n'obulwadde ebweru. Era kikkaatirizaako minisita n'agamba tetutwalanga bulwadde bwaffe ebweru, era tetugenda butwala. Era ne buno bannayuganda abatuwulira mwenna nti abalwadde baffe bonna abayi oba contacts bonna tubalina, era tewali muntu anaatwala obulwadde bwonna. Uganda ayongedde okukkaatiriza nti Uganda eri safe okukola emirimu gyayo, eri safe abalambuzi okujja, eri safe n'ebyabamaguzi okujja, ne business abakola business bajje mu ggwanga nga tewali abakwata ku mukono. Uganda eri sawulire baba responsible, kubanga nabo bw'owandiika ebintu ebijanjaza ku ggwanga lyo, abantu ne babula okujja mu ggwanga, business ne ziyimirira, ebyamaguzi ne biyimirira, abalambuzi ne balekerawo ne bakansolinga. ekyo kiba kituleetera ffe ng'eggwanga okukola ki okunafuwa ate nga tulina obusobozi so twagala nga waliwo alaati zonna ezizze mutukubire ku nnamba eno 080000606 musobola okuweereza ne message ku ssimu zammwe nga mukozesa koodi eyo 67767 tujja kubikolera tujja kufuna message eyo ku call center zaffe twekkaanye ebyo ebinaaba bizze mwebale nnyo mwebale eddala.
I will repeat a toll-free number 0800 1066. But also we have again a toll-free SMS which is 6767. Put the information, be as specific as you can, where, who, and when. These are the most important things, where, who, and when. Then our teams either will come back to you or they will pick up the issue. We also think that we have other ways where you can easily send information which we'll be able to deploy in the coming days. But again, repeat the toll-free number 0800 1066 and SMS on all networks 6767. Thank you. Honorable Minister. Oh, yes.